Imagine this. You are a student or just start work. It's Friday night, you finish the class or work, and you go out for a party with friends. One thing led into another thing. No condom, no worries. You feel fine the next day. But inside, a tiny sparrow drum just moving. What is syphilis? Syphilis is a sexually transmitted infectious STI. It's caused by Trobe pallidum, a bacteria that was first discovered in the 15th centuries. It is called sparrow bacteria because it looks like a miniature bottle opener under a microscope. This sharp helps it penetrate soft skin and tiny wounds during vaginal sex, oral sex, and anal sex. Unlike some other bacteria, this kind of bacteria hides very well. This is why it remains a public health issue to this day, even with the help of modern medicine. Now that we know how syphilis came about, next, let's take the first-person perspective of Trobe pallidum to introduce its invasion. Hello everyone, my name is Trobe pallidum. Normally, your skin is like a fortress, strong, intact, and ready to keep intruders like me out. And inside your body, you have a little soldiers called white blood cells. They protest day and night, looking for stress. As me, I'm clever. I wait for just the tiniest break, maybe a microscopic cut during sex, and sleep in before anyone notices. Once I'm inside,
perfect hideout.
I hitch a ride through your blood and lymphatic system, moving quietly, fast, and unseen. Your immune system tries to find me, sure, but here's my secret weapon. I can change the way I look. I wear a different coat every time. This trick is called antigen variation. It confuses your immune cells. They don't even recognize me as the same invader. So while they are researching for yesterday's version of me, I'm already hiding somewhere new. That's why I can live inside your body for months, even years, without being noted. No fever, no pain, just silence until it's too late. I'm patient. I'm waiting for your guard to drop. Then I make my next
How about some
move.
action?
Now that I've made myself at home inside your body, let me tell you what happened next. My journey is 4 stages, each one a little sneakier than the last. Stage 1 is called primary syphilis. About 2 to 3 weeks after I enter, I create a small sore where I sleep in. It's called shinker. It doesn't hurt, so many people ignore it. It might be on your genus, mouth, or even your anus. And after a few weeks, it disappeared, but I don't. Where you think you are fine, you already move on. Stage 2, secondary syphilis. A few weeks later, I start affecting your whole body. Now you may get a flat, red rash on your hands, feet, or torso, fever, swollen lymph nodes, hair falling out in patches, sore throat or muscle aches. Some people even develop white punctures in their mouths. Again, these symptoms might feel like a cold or flu. They disappear afterward, but me, I just hiding deeper. Many people don't connect these symptoms to a past sexual encounter, so I keep going. Stage 3 latent syphilis. This is the silent phase. No rash, no sores, no signs at all. You might feel totally healthy for years, but I'm still here, living inside your organs and tissues. Only a blood test can detect me now. That's why regular STI testing is so important. Now, if you ignore me for 10, 20, or even 30 years, I don't stay quiet forever. I come back, not with a sore or rash. I might infect your brain, causing memory loss, personality changes, depression, seizures. That's called neurosyphilis. I might blind you by inflaming your optical nerve. I might reach your heart, destroying your valves, obscuring your other rays. You may not know I'm there until it's too late. I can even enroll your bones, weaken your spine, or eat your holes in the skin. These are called gammas, robbering, disfiguring tumors. Sounds medieval? It is. And once you've reached this state, the damage I cause is often permanent. You can treat me, but I may have already left scars on your body and your life. That's why doctors fear me. That's why I called the great imitator, because I wear a mask of so many other diseases until it's too late. Let me tell you about John, a typical 20-year-old. One night, he had unprotected sex. He saw a small painless sore. It didn't hurt him, so he ignored it. The sore healed, but inside, the infection stayed. For 5 years, he felt fine. Then, headache, memory loss, confusion. He went to the doctor, blood test, diagnosis, Syphilis. The bacteria had reached his brain. John said later, if I had just done a simple test back then, one injection could stop everything. Getting rid of me isn't hard at all. In Singapore, you can get tested at polyclinic, public hospital, or private sexual health clinic. It's safe, fast, and confidential. Pregnant? The government provides free screening to protect unborn babies from congenital syphilis. Sometimes I hide so well that the test shows a false negative. That's why doctor might repeat the test or check your spinal fluid if I've reached your brain. But once they find me, penicillin can wipe me out. It's been the trust cures for over 80 years. Just one or a few injections, as long as you complete the full treatment, I'm gone. The best part, I haven't developed resistance to penicillin yet, unlike some other STIs. Let's talk about prevention and the biggest reason people don't get tested. Shame. Syphilis is still surrounded by stigma. Some people believe it only happens to promiscuous people or those in the sex industry. But here's the truth. Syphilis is rising everywhere, including among students, office workers, young couples, and even pregnant women. Many people don't get tested because they are afraid of judgment from doctors, partners, or even themselves. But syphilis doesn't care who you are. So how do you stay safe? Always use condoms, even for oral sex. Talk honestly with your partners about STIs. Get tested regularly, especially if you have a new partner. If you are pregnant, get screened early to protect your baby from congenital syphilis. In Singapore, this penicillin injection is usually administered as a single intramuscular injection for early syphilis. For advanced cases or when the infection spreads to the brain, patients may need to take penicillin multiple times over several weeks, sometimes by intravenous injection in the hospital. After the treatment, the doctor will repeat a blood test to check if the bacteria has really disappeared. Most people will fully recover, so never skip the final test.
Oh my God! Wow!
Singapore's National STI Control Program gives young people access to safe private screening. Free or no-cost STI clinic helps remove stigma and fear. Some clinics even have drop in testing days for young adults. MSM or sex workers, so no appointment stress. The government and schools also run sex education to teach safe practice. But talking about STIs can still feel hard. Many avoid tests because they fear being judged. That's why shame factors stay open and knowing where to test really matters. So here's what you need to remember. Syphilis is old, but it's not gone. It's sneaky, it's serious, and it's spreading again. But here's the good news. With one simple test and one injection, you can stop it completely. Be smart, use protection, get tested regularly. Learn the science. Talk to a partner. In Singapore, help is close. Testing is confidential and treatment is effective. This This isn't just about you, it's about your health, your future, and protecting the people you love. You deserve to be healthy, you deserve to be informed, and you deserve to be safe. Share this video, start a conversation. Because the more we know, the safer we all are.
哎呦我的妈！你别笑。